Hello, my name is Brito. I'm a student at Delaware Technical Community College in Georgetown, Delaware. Today, my classmates Elise, Lindsay, Kelsey, Christiane, and I will be discussing a disease called cerebral hypoxia. We will also be discussing the causes, symptoms, treatment, prevention, and much more. What is cerebral hypoxia? Cerebral hypoxia is a condition in which there is a decrease of oxygen supply to the brain. The brain needs supply of oxygen and nutrients to function. Some symptoms of mild cerebral hypoxia include inattentiveness, poor judgment, memory loss, and a decrease in motor coordination. Brain cells are very sensitive to oxygen deprivation and can begin to die within 5 minutes after oxygen supply has been cut off. When cerebral hypoxia occurs for a long time, it can cause coma, seizures, and brain death. In brain death, there is no activity in the brain. Having low blood pressure can be a cause for cerebral hypoxia. If your blood pressure is 90/60 or lower, you have low blood pressure. Some people have low blood pressure all the time, but they have no symptoms and their low readings are normal for them. In other people, their blood pressure drops below normal because of some event or medical condition. Low blood pressure is a problem if you experience the following signs and symptoms such as dizziness, fainting, lack of concentration, blurred vision, cold, clammy, pale skin, rapid, shallow breathing, depression, fatigue, nausea, dehydration and unusual thirst, and extreme cases, shock. Low blood pressure can also occur with prolonged bed rest. A significant loss of blood from major trauma, dehydration, or severe internal bleeding reduces blood volume that can lead to severe drop in blood pressure. Medications can lower your blood pressure like diuretics and other drugs that treat hypertension. Heart medications such as beta blockers, drugs for Parkinson's disease, tricyclic, antidepressants, erectile dysfunction drugs, particularly in combination with nitroglycerin, narcotics, and alcohol. Other prescriptions and over-the-counter drugs when taken in combination with high blood pressure medications. Heart problems with heart valves, heart attack, heart failure may prevent your heart from circulating enough blood in your body. Allergic reactions can occur to people who are highly sensitive to drugs such as penicillin, foods such as peanuts or bees or wasp stings. This can cause breathing problems, hives, itching, a swollen throat, and a sudden dramatic fall in blood pressure, and it can be fatal. A lack of vitamin B12 and folic acid can cause anemia, which in turn can lead to low blood pressure. Another cause can be a stroke. Stroke happens when blood flow to the brain stops. Within minutes, brain cells begin to die as well. Ischemic stroke is caused by a blood clot that blocks a blood vessel in the brain, and a hemorrhage stroke is caused by a blood vessel that breaks and bleeds into the brain. Many strokes occur when the blood supply had been briefly cut off. Symptoms of a stroke are sudden numbness or weakness to the face, arm, or leg, especially on one side of the body, sudden confusion, trouble speaking or understanding speech, sudden trouble walking, dizziness, loss of balance or coordination, severe headache with no known cause. If you experience any signs and symptoms, consult your doctor or go to the hospital right away.
Lindsay Perry, and my topics for cerebral hypoxia are drowning and cardiac arrest. Cerebral hypoxia is defined as a condition that occurs when not enough oxygen is getting to the brain. In both cases, cardiac arrest and drowning, the heart and nutrient supply is stopped. Drowning is defined as suffocation under a body of water, may it be water or another form of liquid. Drowning causes a lack of oxygen to reach the brain. Defines cerebral hypoxia and is one of the causes of this condition. There isn't a defined cure for drowning besides prevention of accidents involving water and being cautious. Cardiac arrest is a form of shock to your body. This is when your heart ceases to beat. Your heartbeat is controlled by electrical impulses. When those impulses change pattern, the heartbeat becomes irregular. Cardiac arrest occurs when the rhythm of the heartbeat is irregular. Arrest has resulted in machines to regulate your heart and vitals. This machine can be assisted at home as well as in the hospital. The NINDS is a group who supports and conducts studies aimed at understanding neurological conditions such as cerebral hypoxia. They are finding ways to prevent and help prevent episodes of cerebral hypoxia and other neurologically focused problems.
Hello, my name is Albury, and I'll be discussing two causes of cerebral hypoxia. Cerebral hypoxia is basically the lack of oxygen to the brain. So one cause of cerebral hypoxia would be a drug overdose. A drug overdose is basically when one person takes too much of a certain drug that their body cannot handle. So like opioid or heroin overdoses are examples of overdoses that tend to lead to cerebral hypoxia, which causes a decrease in birth weight, which leads to slow, difficult, or even no breathing at all. So to prevent this, so you won't get cerebral hypoxia or a drug overdose, you can take the recommended amount or correct amount of a medicine. Also, don't do drugs alone, so in case anything happens, you have someone there with you for support and help in your time of need. Also, don't mix drugs together, which can make a drug more harmful to your body than just taking the drug alone. Another cause of cerebral hypoxia would be newborn injuries before, during, or after birth. So, like too little oxygen in the mother's blood during or before birth, problems with the placenta separating from the uterus too soon, also long and difficult delivery, problems with the umbilical cord during delivery, serious infections in the mother or the baby, also high-low blood pressure, also the baby's airway may not be formed correctly or it might be blocked. Baby's blood cells cannot carry enough oxygen. All those can lead to cerebral hypoxia. Also, to prevent this, you can decrease birth time, like having a birthing assist, like someone professional with birthing assistant there. Also, resuscitation at birth in case the baby can't breathe or the airway blocked, and someone certified, like a birthing certified assistant there, can help. So in conclusion, with cerebral hypoxia, the brain basically needs oxygen at all times to operate correctly or it will shut down. Without oxygen, cells in your brain won't work properly.
Hello, my name is Baynard, and I will be discussing two other ways in which you can get cerebral hypoxia, and those ways are choking and strangulation. Choking is defined as having severe difficulty in breathing because of constricted or obstructed airway in the throat. There are many ways causes for choking, such as eating too fast, improperly fitted dentures, drinking alcohol, and breathing in small objects. There's ways you can prevent these. Eat slowly and chew your food thoroughly. Make sure your dentures fit properly. Don't drink too much alcohol before you eat, and keep small objects away from children.
Strangulation is the action or state of being strangled. One of the top causes of strangulation in children is due to strings or cords around your house. These cords can be found on window blinds, furniture, or even children's own toys. To prevent this from happening, tie up all the cords on your blinds, check around the furniture in your house, and thoroughly check all children's toys for any strings or cords. For adults who practice jiu-jitsu, there is a common strangulation technique which involves applying pressure to the neck region and blocking blood circulation to the brain.
Hello, my name is Elise Moore. Carbon monoxide poisoning is one of the causes of cerebral hypoxia. Carbon monoxide is an odorless, colorless gas that, if exposed to, can cause sudden illness and death. Carbon monoxide is found in combustion fumes, such as those produced by cars and trucks, small gasoline engines, stoves, lanterns, burning charcoal, and wood and gas ranges and heating systems. Carbon monoxide from these sources can build up in enclosed or semi-enclosed spaces. People and animals in these spaces can be poisoned by breathing it. The most common symptoms of carbon monoxide poisoning are headaches, dizziness, weakness, nausea, vomiting, chest pain, and confusion. High levels of carbon monoxide inhalation can cause loss of consciousness and death. Unless suspected, carbon monoxide poisoning can be difficult to diagnose because the symptoms mimic other illnesses. People who are sleeping or intoxicated can die from carbon monoxide poisoning before ever experiencing symptoms. Red blood cells pick up carbon monoxide quicker than they pick up oxygen. If there is a lot of carbon monoxide in the air, the body may replace oxygen in blood with carbon monoxide. This blocks oxygen from getting into the body, which can damage tissues and result in death. Carbon monoxide can also combine with proteins in tissues, destroying the tissues and causing injury and death. All people and animals are at risk for carbon monoxide poisoning. Certain groups, unborn babies, infants, and people with chronic heart disease, anemia, or respiratory problems are most susceptible to its effects. Each year, more than 400 Americans die from unintentional carbon monoxide poisoning. More than 20,000 visit the emergency room, and more than 4,000 are hospitalized due to carbon monoxide poisoning. Fatality is highest among Americans 65 and older. Carbon monoxide poisoning can't be seen, it can't be smelled, it can't be heard, but it can be stopped. Install battery-operated or battery backup carbon monoxide detectors near every sleeping area in your home. Check carbon monoxide detectors regularly to be sure they are functioning properly. Have your furnace inspected every year. Never use a generator inside your home or garage, even if doors and windows are open. Only use generators outside more than 20 feet away from your home, doors, and windows. Have your heating system, water heater, and any other gas, oil, or coal burning appliances serviced by a qualified technician every year. Do not use portable, flameless chemical heaters indoors. Although these heaters don't have a flame, they burn gas and can cause carbon monoxide to build up inside your home, cabin, or camper. If you smell an odor from your gas refrigerator's cooling unit, have an expert service it. An odor from the cooling unit of your gas refrigerator can mean you have a defect in the cooling unit. It could also be giving off carbon monoxide. When purchasing gas equipment, buy only equipment carrying the seal of a national testing agency. All gas appliances must be vented so that carbon monoxide will not build up in your home, cabin, or camper. Never burn anything in a stove or fireplace that isn't vented. Have your chimney checked or cleaned every year. Chimneys can be blocked by debris. This can cause carbon monoxide to build up inside your home or cabin. Never patch a vent pipe with tape, gum, or something else. This kind of patch can make carbon monoxide build up in your home, cabin, or camper. Never use a gas range or oven for heating. Using a gas range or oven for heating can cause a buildup of carbon monoxide inside your home, cabin, or camper. Never use a charcoal grill or a barbecue grill indoors. Using a grill indoors will cause a buildup of carbon monoxide in your home, cabin, or camper unless you have it inside a vented fireplace. Never burn charcoal indoors. Burning charcoal, red, gray, black, or white, gives off carbon monoxide. Never use a portable gas camp stove indoors. Using a gas camp stove indoors can cause carbon monoxide to build up inside your home, cabin, or camper. Never use a generator inside your home, basement, or garage, or near a window, door, or vent. Have a mechanic check the exhaust system of your car every year. A small leak in your car's exhaust system can lead to a buildup of carbon monoxide inside the car. Never run a car or truck in the garage with the garage door shut. Carbon monoxide can build up quickly while your car or truck is running in a closed garage. Never run your car or truck inside a garage that is attached to a house. And always open the door to any garage to let in fresh air when running a car or truck inside the garage. If you drive a vehicle with a tailgate, when you open the tailgate, you also need to open vents or windows to make sure air is moving through your car. If only the tailgate is open, carbon monoxide from the exhaust will be pulled into your car. Carbon monoxide intoxication is one of the most common types of poisoning in the modern world and the leading cause of death by poisoning in the United States. We hope you enjoyed our presentation on cerebral hypoxia. References will be submitted separately. Thank you for listening. Bye-bye.